Hello, I'm Kenneth Reese, founder, owner, and operator of WataugaOnline.com, and we welcome you into this information session today. The demand for home child care is a major topic now that schools are returning back to remote learning here locally. And today we hope to provide information for those that may be wanting to set up those services in a home or business. Today, I'm pleased to be joined by representatives of the Children's Council of Watauga County and the North Carolina Division of Child Development. Let me welcome in and introduce the panel today. Roberta Yates will speak for a couple of minutes about the Children's Council and how we can help child care centers and families. Lee Marshall is a licensing consultant for Watauga County, and she'll talk a little bit later on about her role with early learning centers and family child care homes. And finally, Bonnie Mathis is a licensing supervisor with the North Carolina Division of Child Development, and she'll speak about her role and what they are seeing stateside, or statewide rather, in this new era. So I welcome you all and thank you for your time today. And Roberta, we'll start with you to give those of us that are not familiar with the Children's Council, give us a little more information about your work and some more insight.
Sure. First of all, thank you for having me here and for having this conversation that we can share information and resources to our community in a time where there is a crisis. And there are a lot of families scrambling to figure out some school-age care options. So we appreciate you drawing attention to this. So a little bit about the Children's Council. We've been around for about 43 years, serving the community in a variety of ways. Our goal really is to build a strong foundation for children's learning and development, and that fits under two umbrellas. One is through family support, where we recognize that parents are children's first teachers. And so we want to provide services for parents to have the resources and the tools that they need to feel that they can successfully parent their child. And then the other umbrella is we provide resources to early educators in the community. And that could be through professional development training, through technical assistance. Again, it could just be through helping them identify needs and finding ways to meet those needs. So we provide that support in the hopes that through that, we are promoting high quality early education, because we recognize that's really the most critical, important time developmentally.
Mm-hmm. So let's talk a minute about, in the introduction there, I talked about the, and let me get the official terminology, I guess, that I had from Mary Scott. Home child care, and then she had also referenced or family, friend, and neighbor care. Now those are, even though those are two separate things, right, but kind of fall under the same umbrella.
Well, not exactly.
Okay.
And I'm going to let Lee actually maybe touch on the family child care home, but the family, friends, and neighbor care is really a system of support that has been put in place to try to address this need. And so really what you're looking at is community members, whether it be a neighbors or friends, pulling together and helping each other out in this time. So it could be that you have families who are rotating childcare in order for the parents to be able to continue to work and the children be in a safe, structured environment. Or it could be a grandparent who has stepped in and is helping to care for, family members during this period of time when the parents have to work and the children do not have a program to be at during the day. So that really, the family, friends, and neighbor care is an informal arrangement between, two parties who are trying to provide creative care in this time where there is not a lot of structured programs for school-age children.
Are you seeing, oh, sorry about that. I come through somebody's computer speakers again. Are you seeing a lot of that happening now, and especially since March, this informal arrangement that you mentioned?
what I've seen is people are creating learning pods, which is a way for families to get their children together and, you know, explore things collectively as a group. So it's a way that parents can rotate where children may gather at one house for a period of time to work on certain subjects, and then they may rotate that to another family's home for a different day. So we are definitely seeing the interest in that, where parents realize their children really need that social connection with their peers, and that's been a big impact with them not being on site in the schools. So we're seeing that. And then I think we're also seeing people just having to be creative and utilizing, like we said, friends and family to help provide childcare throughout the day.
Lee, let's turn it over to you for a moment. And as I mentioned in your introduction, you're a licensing consultant for Watauga County. First things first, explain to us that may not be all that familiar with that term. What exactly is your role?
Well, actually, let me back up just a little bit and tell you I'm a native of Watauga County, and I worked with the Children's Council for 17 years, so I know Watauga pretty good. However, I do cover Avery and Mitchell County as well in my job. And as a licensing consultant, my job responsibilities is to make sure that that childcare is operating legally in those areas. So those that are licensed, and I monitor them throughout the year, and make sure that their staff is there with their criminal background checks and things like that.
Mm-hmm.
All the way down to making sure that just general safety things are being done. But also, if somebody calls me or sends in a complaint and says that there's somebody operating illegally, then it's my job to go and investigate that and determine whether or not they're operating legally or illegally. And if they are operating illegally, we try to give them the tools to, here's what you can do to get licensed. And then if not, then here's what you have to do, because unfortunately it's illegal. It's a felony to keep more than 2 children that's not related to you.
And that was going to be my next question. What is the number? And you just said more than 2 children that's not related to you.
Correct.
Do you find that is more of an issue now than when you first started in this role? More of these facilities operating quote unquote illegally?
Well, unfortunately, well, I should say fortunately, I haven't heard of anything, but of course that doesn't mean that they're not out there. They're just maybe not being reported, or I'm sure that it's happening because of what's going on right now with the schools operating remotely. I worry about children being left at home alone more than anything. But of course, we also have a lot of people here that don't have family to rely on, that they've moved here from other places because of, being in a college town. We have a lot of people here that, they're having to rely on people, just friends or acquaintances, or they're actually having to pay out of pocket, which can get quite expensive. Just for an example, I have a friend that's a single mother of 2, and she's looking at having to pay out of pocket almost over $600 a month.
Oh, wow.
So, and her kids could receive subsidy, but because school is typically in session right now, they will only pay for after school. So, that's the rest of that's being left up to her to do. So I can see the financial strain that's on families as well. So we want to give them some good options.
And we'll come back and talk in a few moments here about how folks that want to get more involved with the early learning centers and the family child care homes, how they can do that. Let's move over to Bonnie for just a second. We're talking about the local level. Bonnie is with the North Carolina Division of Child Development and covers more, or her area of expertise, I guess, is more statewide. Is that correct?
Well, I'm a licensing supervisor. We have 17 teams across the state of North Carolina, and I am the licensing supervisor for Team 1, which consists of 16 farthest west counties in the state. I have a team of 7 consultants, 1 lead child care consultant, and myself. So my primary focus is to receive information at the state level and then relay it to the local consultants, as well as help them to implement and, brainstorm and figure out what we need to do to assist the community and the child care needs.
So in your role, how have you seen things change since March? Obviously, the demand is greater now than in March, but what else are you seeing that's different?
Well, I mean, it's been completely different since March 16th. The world for childcare has changed. We went from many programs being closed to gradually opening as they were deemed essential workers for those folks that had to be on the front line. So we worked with those programs to try to assist them, help them through this crisis. The Division of Child Development Early Education with federal funding has provided grants, and there's been other additional subsidy dollars that's been given to facilities that are continuing to operate, beginning in March, April. Actually, I think it went through June. The majority of our programs now are open or are beginning to open now that school is back in session. So there has been the hardship. At first the children were not, some centers were open, but no children were attending, as parents were staying at home as well. Now that parents are back into the workforce, the need certainly has come back to surface that, more child care facilities needed to be open. But now we have the situation with the school age component that is in need due to the change in the public schools going from the Schedule B or Schedule C, depending on what your specific county is doing and how to accommodate that need. So the agency has, put into place some emergency temporary rules to assist licensed programs to allow them to open additional space if they have it, have the availability for additional space to be able to accommodate school-age children, and giving them the 6 months to comply with all of the required inspections that they need. So, it's been forever changing. That is for sure.
And that's what I was going to bring up too. That's unique for your situation because not every county schools, not all the county schools are operating on the same model. Of course, here in Watauga, we're doing remote learning now. It's my understanding Avery County is going back, I think it's 2 days a week. I think Ashe County's doing the same thing. Caldwell County's doing the same. So in your role, Bonnie, that's very unique that in your team, each county that you ever see is different.
That's correct. And we're taking each county and that consultant that's assigned to that particular county is trying to adapt and assist those child care providers to be able to accommodate the need for parents to have coverage for their children during the days that they're not in school, which a lot of them are completely virtual. I currently live in Henderson County. They're all virtual. Buncombe County, the Asheville area, is turning virtual beginning Monday. They've been actually tomorrow. I think every day is virtual tomorrow. So it has been very unique, and we really, as an agency, I want to just give some props to the Division of Child Development Early Education, and our director, Christy Snuggs, has been on top of things, and they're working with attorneys through DHHS to see how we can adapt and make changes to accommodate the needs of the individual communities out there and serving these families that are in need for care. You know, the biggest hurdle is the subsidy funding, as Lee mentioned, for full day. For those that are eligible for subsidy funding, unless we receive additional federal dollars, they're limited at this point to only receiving reimbursement on that before or after school rate and not a full day rate. So that expense, unfortunately, is falling back on the parents at this time. We do hope that changes.
Yeah, of course, federal dollars for your program, for school lunches, a lot of areas that are still affected by COVID have got a lot of folks stressed out. And like you said, we certainly hope that money comes through soon. Roberta, let me turn it back over to you. I'm on the childrenscouncil.org website right now, and you have a resource page on there for those caring for children and parents looking for care. A lot of detailed information on there. I noticed that you just wrapped up last week some information sessions regarding family child care. How did those sessions go, and will you be having more? And you're muted, by the way.
Thanks. I do that all the time.
Oh, I think we all do.
Yes, you know, we're really trying to get ahead of this and be proactive and provide information to the community so that parents know of some options. And so those meetings were set up to, one, share information for anyone who maybe is considering taking children into their home, or it could even be somebody who has lost employment, and so they are revisiting some options as far as, you know, employment. So we wanted to give them information, but we also wanted them to have the legal aspects of it, of how to do it properly. Because as Lee had mentioned, people are scrambling to make things work. And so we want to ensure that children are safe and that individuals are complying with the state standards when they're providing child care.
And again, for the viewer, oh, sorry, there once again, I'm coming through somebody's speakers. For the viewer, that is the childrenscouncil.org website, and it is, there's a little section right there on the front page. I think it said updated child care, but you'll find it. Yeah, new updates, caring for children in Watauga County is where you can find that information. So Roberta or Lee, whichever one of y'all want to answer this first. Let's say that someone watching this or listening, they want to operate the licensed child care in their home or business. What is the first thing they need to do?
I'm going to turn that over to Lee since she is the expert on this.
Well, I don't know that about sorry about that. I will say that our website, which is the Division of Child Development and Early Education's website, has a lot of information as well. And there's a checklist that they can look at first, and it may be on, Roberta, it may be on the Children's Council's website, I'm not sure. That's a good place to start, just to look at what is required. It's an extensive one, but it's very doable. We have 8 family child care homes here in our county, and the majority of them are 5 stars. They would need to, you know, like I said in a previous meeting, I was on a meeting just a few minutes ago with the Faith Collaborative, talking to some of the churches that are interested in doing something to help out the community as well. But I was telling them that pretty much there is some deal breakers. One of them being the one that sticks out in my head, having spring water versus like well or city water. That's a deal breaker. You can't have spring water. But other than that, it's an easy list to go by. And then they would also need to get enrolled into a pre-licensing workshop which Bonnie, I'm not sure when those are coming up available, but they are listed on our website when you can get in those. They're limited to 8 people, or 10 people total, and there's usually 2 instructors. Bonnie's usually one of the instructors, I think, right, Bonnie?
Well, that's getting ready to change, but yeah, I have been an instructor in the past, yes.
Okay. So, and that's a workshop that they would be required to do as well, that goes over all the rules and regulations. But certainly, I think that Roberta is available to kind of just go over and look at some things at their home. Our lead consultant, which is Monica Hauk, she is the one that would actually be the one doing giving the license or issuing that license. And then once they're licensed for 6 months, then they would be turned over to me to monitor.
And the website you mentioned is, and I'll make sure and link this when I embed this video, both on WataugaOnline.com and on social media. But the website that Lee mentioned is ncchildcare.ncdhhs.gov. I know that's a lot to remember just on the fly, but I'll make sure to embed that, because you are right. I just clicked on get the latest COVID-19 information, and it is a very detailed list of items that's on there. And as you mentioned, that would answer a lot of questions I think that folks might have.
And Kenneth, I think one of the things we had talked about in some other meetings is telling the community what are things that they can do during this time period that fall under the legal parameters. And
yeah, let's talk about that.
Okay. Lee, do you want to jump in on that, or do you want me to?
It doesn't matter. I can do that.
Okay.
So one of the things, of course, we talked about is keeping 2 children that's unrelated to you in your home. You can do that, or you can become licensed to go further. Then communities can also you can also do like a group setting. So like if a church wanted to do something, they can do something for 4 hours or less per day without going through the licensing process. And that is helpful. So if there's working families, they might need longer care than that. And we can get a little bit more into detail about that. But you can also do something for churches or businesses can do something for 4 months or less without going through the licensing process. And that would be considered like a recreational or a seasonal because of the 4-month time period. So those are some of the things that you can do.
Are you finding right now that the faith-based community is becoming more involved than maybe in previous years?
Definitely. I heard from one church that has already got they were all familiar with the rules and regulations. And they actually called theirs, what did they call theirs? I'm not seeing it right now, but they're calling theirs not a learning hub per se, but they knew that they couldn't do more than the 4 hours a day. So they're doing that at their church. But go ahead.
Oh, I was going to say, when you mentioned the 4 hours a day, are the organizations that want to set this up, are they able to decide which 4 hours they want to do, morning or afternoon, or is that already mandated that they have to do it during a certain time?
That's a very good question. No, it's not mandated as long as it's not, they can't spend 4 hours in the morning and then go to lunch and then come back. It has to be it's tied to that facility. So if one church wanted to do 4 hours in the morning and then another neighboring church wanted to do 4 hours in the evening, then they could certainly do something like that. But they are tied to that 4 hours. It doesn't matter which ones.
And that's on the local level. We were talking about, the faith-based organizations becoming more involved. Bonnie, are you seeing that in the area that you deal with as well?
Oh, absolutely. I mean, there's been a large I want to say, just a variety of different, the communities across the board have become very creative. And so they see a need, they're trying to meet that need. And we also have, they put into place the Department of Health and Human Services with superintendents or public schools, that a public school can contract within a community agency such as a church or a business in the community to be a off-site public school to assist with the virtual learning and not be licensed. So that is an option that is available, and that's not limited to a certain amount of time. It can be full day. Most of the time in that particular situation, the school is still providing a lunch or a bag lunch for the children if that's an option for your area. So we're kind of seeing that pop up, that superintendents or principals in local counties are reaching out to community agencies for that service for the children. But it is a variety. We've had a lot of calls, a lot of can I do this, can I do that kind of scenarios, trying to figure out how they can be within the law and still and operate and provide that service. So, but Lee is correct. The one of the biggest questions that I have is, can I operate a 4-hour virtual hub where they're doing their homework, their assignments, they have lunch, and then we do gymnastics in the afternoon, or dance, or some other activity, and fall under the seasonal recreational 4-month consecutive time period. And because you're actually you're not a recreational or seasonal program, or doing an emphasized specialty, then you don't fall under that criteria to operate on that consecutive 4-month period. So then if you exceed that 4 hours, then you are operating an illegal operation. So for those folks, I'd say contact your local schools.
And I'm glad you mentioned businesses too, because I had mentioned faith-based organizations there a couple of times, but it's also important to reiterate and maybe remind folks that don't know, because I was kind of struck by it too, the fact that businesses, and obviously it's going to depend on what kind of business you have, but you know, they are able to set up these facilities too, if they so choose to do.
Right. And it seems to be the folks that, have a gymnastics or a dance studio, something on that, some recreational piece or learning specialty that they offer. We've even had some bowling alleys across the state offering a service like this. So they can fall under that. Just know, if they've already operated a school program for the summer or a camp for the summer, their consecutive time has already started. So it's only 4 months within a year, a calendar year.
And again, for the viewer, and I'll link these both web pages and all of this resource information, the childrenscouncil.org. We got a lot of local information there, and then ncchildcare.ncdhhs.gov, a lot of information there too. Let's go around the horn one more time. Roberta, let me come back to you. Anything that maybe I have failed to mention, or maybe has come to mind for you that you'd like to reiterate or talk about as we start to wrap up this information session today?
We want to offer our support and our services to programs who are out there, whether it be that they need some assistance with materials or their routine or health and safety guidelines, especially dealing with COVID, that we want to be a resource for programs, whether it be that they're operational or that they're looking to open something to support families. You know, the other piece of what we do is we also serve the parents through a variety of programs, and we're getting ready to start one called The Incredible Years, which is a 14-week virtual program that have built-in incentives for families. So that's an option just for parents who may need some extra tools and resources as we're going through a hard time. I mean, parenting is hard enough, but throw in a pandemic and virtual school, and it definitely has challenges. And then we also have other programs as well. There's Circles, which is a virtual support group We have parents programs for expected moms. We have a visiting home program called Family Connects. So we want to have a wraparound care for families and anyone working with young children right now to support them.
And more information is available at thechildrenscouncil.org. Lee, let's turn it over to you. Any last thoughts you'd like to leave us with, or anything we may have missed?
The only thing I can think of that I wanted to say was that there are lots of churches that are interested in helping, and we talked a little bit about the school system and contracting with them. I think the school system was worried about what their responsibility is in that part, and as far as like who's to pay the caregivers. We're looking at a lot of volunteers, so reaching out to maybe retired teachers or anybody that wants to give back to the community. They may want to connect with their church or one of these churches that may be interested in doing this, because we want to offer this at least at low cost, if not no cost, because the school system is not allowed, they're not going to be able to pay staff members or anything like that.
Right.
So, and then I'm here if I can help.
Will there be a list online somewhere of faith-based organizations or businesses that are offering these services once they get licensed or fulfill the commitments?
I would feel certain that the Children's Council would probably list that on their website.
Okay, and I see Roberta shaking her head there in the video, so
Yes.
we'll make sure and keep checking the childrenscouncil.org too, as that list will continue to grow. Bonnie, we'll swing it over to you one last time. Any last thoughts you'd like to leave us with today?
I know it's difficult times, and there's tensions are high, and trying to figure just life as a whole. The Division of Child Development is here to try to support and work with individual communities any way that we can. So it doesn't hurt to ever make a phone call or just to reach out and see if there's something that we can do or provide you with the information that you need to make an informed decision.
And I think that's important for parents and guardians to remember. You might not realize or think that you need help right now, but you might next week or the week after, or unfortunately the week after, as you know, the remote learning, especially for Watauga County, will last for several weeks. But most importantly too, if you are a parent or guardian, again, faith-based organization, business that either needs help or wants to help, again, the childrenscouncil.org is a great place to go to start. And the ncchildcare.ncdhhs.gov. That is a mouthful. And again, I'll link that in the articles. All right. If anybody got any last things, I think we've all wrapped up there and touched on it. I'd like to thank Roberta Yates today with the Watauga County, or the Children's Council of Watauga County. I always put the Watauga County part first. The Children's Council of Watauga County, thank you for your time today. Lee Marshall, licensing consultant for Watauga County, and Bonnie Mathis with the North Carolina Division of Child Development. I'm Kenneth Reese, the founder, owner, and operator of WataugaOnline.com. We hope you enjoyed this information session today, and we may plan on having another one of these in a couple of weeks if need be, if not sooner. To you, the viewer, thank you for your time. Stay safe out there, and until next time, we'll catch you later.